Hi, my name's Dr. Bruce Quinn, and I'm an expert on Medicare policy for new technology. In this short video, we'll talk about some recent Medicare policy decisions and how they reimburse for artificial intelligence, both in the inpatient setting and in the outpatient setting. If you haven't been tracking this, there's actually a fair bit going on. So we'll look first at the hospital inpatient setting, the DRG setting, and then we'll look at the non-hospital or outpatient setting, where CMS values services in RVUs. In the inpatient setting, there are new technology add-on payments, which is basically the only way to get out of the fixed fee DRG. And these are only for FDA-approved technologies, whether those are drugs or devices. They have to meet 3 criteria. They have to be new, not more than 2 or 3 years on the market, have a significant clinical benefit, and meet a cost criterion, that they're relatively costly relative to the DRG. The actual rules are very, very dense. They go on for hundreds of pages every year. And if you pass these 3 criteria in the detailed way they're defined, you get reimbursed 65% of that cost for every inpatient. Here are 4 AI services, all related to imaging or radiology. The first is the contact test, which was last year for fiscal year 2021, just ended. This is for stroke diagnostics. It prioritizes high-risk films that will potentially have stroke when they're read. CMS liked that. It met all 3 criteria. And so hospitals are reimbursed 65% of $1,040 when they use that service. Now, moving into fiscal year 22, which just began, these are new rules. Medicare looked at AI Doc Briefcase for PE that assists in pulmonary embolism diagnosis by bringing things up in the queue for faster attention. The result was no. They didn't feel that was proven to be a significant clinical improvement. For rapid aspects, which is for stroke diagnosis, somewhat like contact, they also felt no. They felt there had not been a clear demonstration of significant clinical improvement, and they made a comment that they felt the contact service the previous year had had more thorough clinical data. We then turned to Caption Health Guidance, which is for cardiac ultrasound using artificial intelligence, and that did meet all 3 criteria. So when it's used on an inpatient, CMS will pay an extra 65% of $1,868. Going to the outpatient setting, what's called the physician fee schedule rule, this just came out the beginning of November for calendar year 2022. There was a lot of discussion here about artificial intelligence and machine learning. CMS definitely wants to promote innovation. However, it does not want to pay for naturally included software. They don't want to see a $500,000 MRI scanner and then a $200,000 bill for software to make it run. They're also concerned not to overpay for overhead on software. For example, when you have devices, they involve rent and square footage, but you don't have that for software, at least according to CMS. So 3 things they talked about in this rulemaking a couple weeks ago. They priced Retinal AI software, which is code 92229, by crosswalk to a similar cost service. So they didn't directly say they were pricing the software, but they were sort of allowing by crosswalking to something that they felt in the end had a similar cost. They also priced the Heartflow code 0503T by crosswalk to something that was similar cost. And they started there by looking at the outpatient APC cost, the hospital outpatient cost for this service, which was around $900. And they didn't say they were using that directly, but they crosswalked to something in the physician fee schedule world that was roughly similar in cost. And finally, for a couple years, CMS has had trouble pricing 5 to 14-day cardiac monitoring services. These are codes 93241 forward. There are quite a few codes there. And they finally decided to price a disposable ECG patch at $205, but declined to implement it for 2022 yet. So it's sort of out there waiting to be implemented, maybe in 2023. So even in this brief review, we looked at 4 different inpatient services using artificial intelligence. We looked at 3 outpatient services using artificial intelligence or machine learning. There's one more example. There's a lab code for a histology test or a histopathology test, a microscope slide test that uses artificial intelligence, and it's been given a PLA code priced at about $600. I don't know if that service is covered yet, but it does have a price. So clearly, CMS is rapidly facing questions of how to reimburse for artificial intelligence and machine learning, and probably this year in 2023, it's going to be more than we've ever seen before. Thanks for watching.